Good evening.
Good evening.
Many thanks for this generous introduction. Many thanks for inviting me for this lecture. I hope that you can bear with me sometimes before going to sleep or going to dinner. Actually, I was very much excited by the invitation of Professor Serag to talk about changing pattern of life during the COVID-19 pandemic. And I hope not with my lecture, not to cause you nightmares this night. One of the changing patterns of life, what we are experiencing right now in this Congress, I'm sitting at home, listening to you, sharing with you my slides, but missing your company. Actually, it all began by the end of last year, the beginning of 2020, when new coronavirus emerged and spread all over the world. After this event, the World Health Organization declared emergency of international concern. And weeks later in March, the disease was considered as a pandemic. And since then, the whole world argued about many questions in an unprecedented. How much do we give up to protect the most vulnerable? Whose lives safe first when hospital and ICUs are overrun with patients? Lives and health versus profit? Have we been under-evaluating or undervaluing those who should be more valued? Saying that the pandemic has changed the world would be. In less than 1 year, COVID-19 has turned our day-to-day activities upside down. To demonstrate these changes in a survey conducted on 1,000 adult US citizens, it was found that 55% reported mental health disorders which resulted from the pandemic. Stress, anxiety, depression, loneliness arise. 8% preventive health care visits were meaning for or otherwise, and even 15% avoids and even injuries. They for not to get infected in the health setting of hospitals. In 62% of the significant better lifestyle changes another side of the coin. Time for outdoors or experiencing nature, improved sleep, starting or an exercise program, other healthy dietary changes. And 68% felt increased awareness on health issues related to stress, anxiety, and depression, more awareness, chronic diseases, autoimmune diseases, physical fitness, but 58% said that the pandemic has changed their way of life forever. So the lessons learned that the pandemic has a detrimental impact on health, not only due to related disease itself, but even far beyond. On the other hand, the pandemic provides opportunities for style. Again, concerning the same survey, one of participants went by the flow of information on COVID-19, no more paying attention to the information they get about the disease. And this particular point, the flow of information, I want to stress on it. Actually, we were facing an unprecedented challenge of facing an unknown disease of the magnitude of stage. The lay people, healthcare workers, policymakers, scientists. We had minimal information on the origin and reservoir, the epidemiology, effective medication, and no vaccine in the early months of the epidemic and later the pandemic. We were facing many unknowns. So the lessons learned was that our sensors were too much insensitive to predict and anticipate a situation of such a magnitude. So remember late 2019, early months of 2020, almost no one could imagine such a situation, could anticipate such a situation. Unfortunately, I consider this a kind of failure of our sensors. So the issue of accessing rapid and reliable information during a pandemic is vital. This is one of the barriers at the early months of the pandemic. Meanwhile, you probably have been introduced to these repositories, the preprint repositories. The cycle of doing research, writing a paper and publishing is too slow during a pandemic. The cycle can take over 6 months to get an information published, to get research results published in a peer-reviewed journal. This is an unbalanced situation, not corresponding to the pace of a pandemic like COVID-19. So researchers use these repositories in which they write the paper and post immediately their research in these repositories. Of course, they are not peer-reviewed. So you have a literature which is not peer-reviewed, and it is left for the reader of the papers to judge whether he can use this information, he can utilize this information or not. Many publications which emerged in the lay press, which penetrated into the lay press and earlier this year, actually were from preprint repositories. And this entails the risk that much of the research was of low quality. A very important issue during a pandemic is desk research. How do you handle with the challenge, with the big challenge, with limited information? Close screening and monitoring of literatures, not only scholarly literature, but also to the lay press, mass and social media. Communicate directly with colleagues around the globe, clinicians, researchers, decision makers. Gather clinical and epidemiological information, ongoing non-published research, decisions in the making of. Critically appraise the scholarly literature by yourself. You are responsible, you are directly responsible to judge whether the produced research results, the paper is mature to be instituted, to be utilized in guidelines, in management, in healthcare management, etc. Respond to rumors scientifically. So it's a kind of intelligence, of medical intelligence, in which you activate all your sensors. I recall that the first communication with my Chinese colleagues was in January 2020. At that time, COVID-19 was not called COVID-19. There were fragmented information on a strange disease in China. And at that time, we got variable information from our Chinese colleagues. And when I communicated again with them in early February, the situations there started to relax in spite of the fact that the information we had in the lay press, that the situation is worsening there. So I estimated a delay of about 10 days to 14 days, 10 to 14 days, till the real information penetrates to the press. So direct communications with your colleagues is very important. We have communicated with our colleagues in Italy, northern Italy, once the pandemic spread there, with our German colleagues, with our British colleagues, and we gathered very valuable information at that time, timely information. At the endemic medicine department at Cairo University, we acted very swiftly. Professor Rabab Fouad, the head of the department, instituted a task force very early in January 2020. This is one of the first reports. We issued a daily report gathering information from the scholarly literature, preprint repository, lay press, personal communications, and even sometimes decisions from policymakers. And we issued for a long time, for several months, this daily report, gathering all these information together. And I think it was very, very valuable in keeping us updated. Desk research and gathering information from various sources is very important. I bring this example up. I like this example. This was a paper which has been identified very early by my colleague Sharif Musa on the potential for global spread of a novel coronavirus from China. This study was based on IATA data. The authors gathered the IATA data and they were able to identify and to predict the areas at which COVID-19 will disseminate worldwide. And they identified 50 airports worldwide, and they predicted that the portal of entry of COVID-19 to Africa would be. This paper was identified in January, in spite of the fact that it has been published in March. So you have to be alert, you have to gather the information very early and not to wait till the publication of the paper during crisis times, during critical times. Otherwise, it would be always too late. So the lessons is, during times of crisis, conventional scholarly information retrieval may be inadequate. The usual way of searching the published literature. Activate all your sensors and critically appraise the literature by yourself. We all remember the debate on hydroxychloroquine and the controversial papers which appeared on hydroxychloroquine. And even several papers which were published in good journal, in reputed journal, were flawed actually. And the flaws were identified by, could be identified by junior staff. So you have to critically appraise literature by yourself during pandemic, is science for direct policy making. And I bring up three examples actually. One example in which policymakers made directly the use of science for policy making even before this research completed the cycle of writing a paper and publishing it. This is a German, this is the Prime Minister of North Rhine-Westphalia, one of the German states, the Prime Minister Laschet, who give an eminent virologist, Professor Streeck, the task of doing research in a focus of a super spreading event. And this research, the results of research, was expected to shape the policy of the German state directly. So research directly in policymaking, irrespective of its peer reviewing or publishing. And actually, indeed, the research has been done. The policy of North Rhine-Westphalia has been adapted according to the research results of this group. And later, the paper came and the publication several months thereafter. Another interesting example is the example of the relation between Niall Ferguson and Boris Johnson. Niall Ferguson, an eminent epidemiologist at the Imperial College in London, was able to convince Boris Johnson to change his policy and was one of the main factor that Boris Johnson instituted a lockdown. And it was this paper, actually, this report released by the Imperial College, which had repercussions worldwide. It's one of the papers which I have been asked several times to summarize in different languages and in different forms because of its tremendous impact. It is about of the non-pharmaceutical interventions, and which means, for example, social distancing for the management of COVID-19. So science and research directly flowing into policymaking. We have also another example. This gentleman, the President of the United States, and his controversial relationship with his physicians and researchers. Actually, we heard a lot from Donald Trump about many interventions. We have heard from him, even many colleagues heard from him about the institution of monoclonal antibodies in COVID-19. We have heard from him hydroxychloroquine, Regeneron. We have heard the names Eli Lilly, Remdesivir, etc., etc., etc. A controversial relation, which is rather the influence of policy on science, policy making into science, rather than science into policy making. A very tricky situation. So the lessons are the interaction between scientists and policy makers in times of crisis should be direct. No time, very often, no time for scrutinizing research results, publishing it, and peer reviewing, etc. The abuse of science and politics and economy is multifaceted, as I have mentioned a few minutes before. An important issue is research and clinical medicine, the immediate response. We as physicians, we were confronted with patients. We have the pandemic. We had limited information about the disease, but at the same time, in spite of the limited information, we had to treat patients. So how to take decisions? How in China and later in Europe and in Egypt, how we were treating COVID-19 patients in spite of very, very few unreliable data. What we are doing, we're trying to extrapolate accumulated experience from SARS and MERS outbreaks and epidemics. SARS and MERS are coronaviruses, and there is limited experience or some experience with the management of such cases, so we try to extrapolate the accumulated experience. Extrapolate results of bench research onto clinical practice, which is quite often very tricky. In silico studies, which are studies done on computer modeling, on the design of molecules to repurpose them, to see whether they can, in these modeling in computers, in silico, referring to the silicon of the computer, so that you can reach the candidate drug from the in silico stage to the in vitro stage and maybe into clinical trials. Clinical studies, there are very few clinical studies at the beginning with varying quality, no well-described endpoints due to knowledge gaps about the virus. And we unfortunately, some of, or many of these studies were misleading because of the low quality, because they were produced, the research was done under the pressure of time, under the pressure of maybe policymaking in countries, in remote areas where we don't know the setup of the research and healthcare. So the lesson is during the pandemic, each healthcare worker should remind himself of his hybrid role, being healthcare provider and researcher at the same time. This is a very important issue which we have to remind ourselves. Each healthcare worker during the pandemic is a researcher. Each healthcare worker is responsible that the patient he is treating is better treated than the patient before. The accumulated experience is very important. Education has been one of the main areas which has suffered from COVID-19, and I'm sure those who have children in school or universities are suffering. They have seen the change in lifestyle, school children's and students, and everyone involved in training. These two maps, the map on the left-hand side shows in purple the countries in which the schools were closed. So most of the world had its schools closed in April 2020. And this is the situation today on your right-hand side with the pink color showing the potentially open, partially open schools, which constitutes to a large part of schools in different countries. So education is one of the areas which is very heavily affected by the pandemic. All levels of education and trainings are affected. Preschool children, 40 million children worldwide have missed early childhood education in preschool year, which means that they miss learning and stimulating environment, learning opportunities, social interaction, in some cases, even adequate nutrition in developing countries because this will compromise their long-term healthy development, unfortunately. For school children, as of April 15th, 1.5 billion school children in 175 countries were deprived of regular school education, with disparities between rich and poorer countries in education expected to increase. Successful digital learning is not, unfortunately, is not the magic solution, because it also needs prerequisites apart from the technical equipment, which may be related to the socioeconomic status. I mean, developing countries, for example. You need a quiet room, you need the parent support, you need digital skills. And these are dependent on the socioeconomic status. Vocational and technical education with lack of apprenticeship, limited work-based learning modes, low-level digitization. Some pitfalls which are discovered during the pandemic. The higher education with the online learning and interaction on digital platforms being augmented, being boosted nowadays, but the development is variable from one university to another, and even in the same university and the same faculties different from one program to another. So we have problems with harmonization across programs due to different pace in different modules. And also we have problems with skills teaching. Many of them cannot be done online. So a tremendous loss in the education sector is expected. A Canadian study estimated an increase of 30% in socioeconomic skills gap due to the pandemic. A disastrous situation, could be a disastrous situation. This is the World Bank scenarios they put for education. The upper plot shows the learning curve with the ability score on the horizontal axis and the number of school children on the vertical axis. And this is the normal pattern. The three different scenarios based on the impact of COVID-19, it could be scenario one, which is about, on the left-hand side, that all ability score are decreased in all students, on all school children. The other scenario is that you get a wider deviation, a flattened, broad-based curve because of the wide variations from area to area, from school to school, in the level of education. And the third scenario on the right-hand side, which shows several peaks. The first peak with the lowest ability score, these are the dropouts, the extreme cases, maybe in developing countries, that we have children, school children who drop out from the education system. And then you have another hump, which is with a better ability score. A very dangerous situation. So the lesson is that education loss will have a tremendous impact on our life that may last far beyond the pandemic. Urgent mechanisms are needed to mitigate the problem, and this should be one of the priorities which should be dealt with worldwide. I imagine, or I think that everyone has noticed the clear air in Cairo and the clear view of the sky in Cairo during the lockdown. And this can be objectivized. These are the nitrogen oxide emissions. I brought here the map of Italy as an example, comparing March 2019 with March 2020 with the lockdown. And you can see the dark red areas are areas with high emissions, which means pollution, whereas the light colored areas, the lighter the color is, the lower the emission. This has been with the lockdown. So apparently it is mankind who is destroying the environment. It seems that we are very, very dangerous for the environment. Social distancing is a term we often hear. It has a tremendous impact. In one study, which is in press, it's going to be published next month, it has been demonstrated that stay-at-home orders are associated with depression, generalized anxiety disorders, insomnia, and acute stress. Distancing behavior associated with depression, generalized anxiety disorders, intrusive thoughts, and stress. Anxiety disorder symptoms increased between February and March 2020. And the symptoms increases were associated with individuals individual social distancing behavior. So social interaction should not be abandoned even with a lockdown and even with social distancing and lockdown. Technology makes it possible. For example, now we are connected together through platforms or an electronic platform. You can hear me, you can watch me, we can have a conversation. We don't rely only on voice communication, but as much as possible, communicating, seeing each other, making jokes together. So trying to replace the gap. Mobility and transportation, we all suffered from limited mobility. Those who were traveling didn't travel anymore. I'm sure that the record has been achieved by some for the total period without travel. So the mobility sector is one of the sectors which is going to be heavily affected by the pandemic, not only during the pandemic, but also beyond. This study has been done by McKinsey and Company and shows the key reason to choose a mode of transportation, either during business trips or private trips, and comparing the pre-COVID-19 era with today, both for the business and the private trips. And as you can see, that the main motivation for choosing a particular or specific mode of transportation is the risk of infection. High up on the scale, where it was very low in the pre-COVID area, getting high up there. And also here, either in business trips or in private trips. A very interesting development. Then other factors play a role. Is the reconstruction of several cities. During the lockdown, the following decisions were taken in major cities across the world. Milan will transform 35 kilometers of streets previously used by cars to walking and cycling lanes. Paris will devote 50 kilometers of lane usually reserved for cars to bicycles. It also plans to invest more than 300 million to update its bicycle networks. Brussels has continued transforming 40 kilometers of car lanes into bike paths, and Montreal announced the creation of over 320 kilometers of pedestrian and bike paths across the city. I myself bought a new bicycle during the lockdown. So the lesson is that the mobility sector is and will be one of the main sectors affected by the pandemic. So the pandemic, and I will conclude by this set of questions. A unique opportunity to rectify an unbalanced and unsustainable situation, a chance for self-reflection, the beginning of the end of an older world order, all of the above, none of the above. Before concluding or before finishing and before thanking you, I have two remarks. First of all, I would like to thank my younger colleagues who are the frontline healthcare workers. A special thanks to my younger colleagues. Without them, we wouldn't have survived the last few months. I feel gratitude towards them. And I remember all our colleagues, our friends whom we lost during the pandemic. Thank you very much.